Do your knees touch each other when you stand? Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video where we're going to be talking about knock knees. So when you stand and both your knees touch against each other, you may be having knock knees. What is knock knees? So your knee is made up of two bones, the thigh bone or the femur and the leg bone or the tibia. The alignment that these bones make decide how your knee is aligned. So if your knees touch, that means you draw a straight line connecting the center of the hip to the center of the ankle. All the way it passes to the outside of the joint. It's called knock knees. If the knee passes to the center, it's perfect. And if the knee passes to the inner part or it's bow-legged, that's called Genu Valgum or bow-legged. The technical term for knock knees is Genu Valgum. Now many times you may or may not have knock knees, but it may look like you have knock knees, or it may be apparent that you have knock knees. Sorry to disturb you, but if you like my videos, if you have a problem in your knee and shoulder, if your family member or friend has a problem in the knee and shoulder, please call the number given in the description. My team can help you fix an appointment with me in person or online. Thank you. Best way to check is something called a standing scanogram or a hip, knee, ankle x-ray, where you stand keeping both your feet together. An x-ray is done from the hip to the ankle to see where the body weight is going. And if the body weight is going on the outside, it's called knock knees. Now remember, everyone's not perfect. A lot of us have thick thighs, so our knees may touch, but that may not be you have knock knees. It's just called pseudo knock knees. So getting a hip, knee, ankle x-ray can demystify this and clarify this. God doesn't make all of us perfect. About 10% of us have absolutely straight knees. The rest have a little bit of bow-legged, a little bit of knock knees. A degree or two on either side is normal. You don't need to do anything. Don't get very scared. But if it's more than that, then body weight, because it passes through one part of a joint more, you may require some kind of an intervention. Now, how does the natural history of our knees progress from the time we are born? So most of us when we are born have bow legs. If you look at any newborn baby, the legs are aligned like this. The feet are here and the hips are closed. Once they become 2 to 3 years of age, the knees slowly straighten up. Then they become a little knock-kneed, and by the age of 7 years, you get your actual alignment. Till the age of 7, nothing needs to be done. However, if they are very apparent, get a vitamin D level done. If it's low, start treatment, because till the age of 7, knock knees can be corrected if the inciting cause is identified without an operation. However, don't try anything like bracing, etc. You're going to make your child feel more and more uncomfortable. There's no scientific basis about it. Now, why till the age of 7 years? Because think about a pillar in your house. Now, when the cement is wet, you can tell your contractor that even if the pillar is a little crooked, to make it straight again without having to break it. But if the cement sets, then if it's crooked, like the Leaning Tower of Pisa, the only way of straightening it is by breaking it again and straightening it, right? So, till the age of 7, bones are a little soft. They can be corrected on their own if the right medicine is given for vitamin D, after which it's not possible. You would need some kind of a surgical intervention if it is more than a certain limit. Now, how is it corrected? More often than not, knock knees are because of a deformity in the thigh bone or the femur, and less commonly because of the leg bone or the tibia. So, think about it. If your knee is like this, all the body weight is going here. The aim is to bring it in the center. So how do we bring the body weight in the center? We crack the bone here. Cracking can be on the inner side or the outer side. I prefer the inner side. Why? Because in the inner side, we crack it, make both bones touch each other, put a plate with screws and straighten it. However, on the outer side, you open up. So when you open up, there's a gap. The gap has to fill with bone. Bone's not touching against bone. It takes longer to heal. So I prefer something called a closed wedge osteotomy on the inner side to straighten it. Same thing if it's on the leg bone, a similar operation is done, fixed with plates and screws. The operation takes about half an hour, 45 minutes. But remember, when you're cracking the bone, it's like an artificial fracture that the doctor gives you. Till the fracture heals, you have to be careful. You can't put much weight for about a month, 6 weeks. After which some weight, and 2.5 months later, you're a free bird. I do certain cosmetic operations also in younger people that have just about crossed puberty but are not full adults yet. Reason is that as you're growing, your bone grows through both ends and the bone is covered and it grows in girth by something called the periosteum. Periosteum is very thick in young children and young adults. So in people that are about 13-14 years of age in girls and about 15-16 years in boys and are very cosmetic conscious, what I do, by a 1-stitch incision, crack the bone, straighten it. I do not cut the periosteum. So the periosteum acts as a lovely jacket to cover my bone and provide stability, and put a plaster around it. I call it a percutaneous osteotomy. It's cosmetic, very predictable, but you have to use a plaster for about 4 to 6 weeks. But a very predictable operation and cosmetic. In older people, yes, it's the plate-related osteotomies that I just explained to you. Now, this is the way we tackle bow legs. This is the latest technology. How do we calculate how much to correct it? There are softwares that I use on which I can accurately determine how much of a wedge I need to basically use to correct your deformity, and we get perfect alignments. Thank you so much for watching my video. I hope you got a lot of information about what's latest and best treatment bow legs in 2026 and knock knees in 2026. If you like my video, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a very popular Hindi channel with a silver play button. Please like, subscribe and follow it. Thank you.